Effect of n-3 fatty acid supplement in diabetes mellitus. Definition: increased intake of n-3 fatty acids has been associated with a reduced risk of cardiovascular disease in observational studies, but this finding has not been confirmed in randomized trials.
How does a diet high in omega-3 fatty acids benefit diabetics?
Omega-3 fatty acids have a multitude of potential benefits. For the diabetic, perhaps there are a couple that are important. The diabetic has a tendency to have an increase in clots. They have an abnormal coagulation status. They make microclots as a part of the disease process, and those microclots will result in retinopathy or injury to the retina at the back of the eye, nephropathy or injury to the kidneys, and neuropathy or injury to the nerves, particularly and most commonly first at the far end of the legs. What fish oil may do is decrease the tendency to form clots just a bit. Typically, people who have diabetes have a sympathetic nervous system that's turned on a bit, and fish oil actually counters that some. Fish oil also would be expected to decrease arrhythmias to an extent, and the diabetic or any cardiac patient would be expected to have more arrhythmias, and they may be able to gain some benefit in terms of using fish oil for them in that way. And we all believe that fish oil is beneficial in people who are at risk for heart disease and even people who are not, but particularly in people who are at risk. And the diabetic actually is given the same level of risk as somebody who has already suffered a heart attack, and we would routinely suggest not only an aspirin, but fish oil for people who are taking for the diabetic patient.
How much fish oil do you recommend?
For someone who has not had a heart attack, that they should get 500 to 750 milligrams of a combination of two of the omega-3 fats called DHA and EPA. For someone who has had a heart attack, and probably the diabetic, they should look at 1,000 milligrams of DHA and EPA to help prevent things that they are genuinely at risk for.
Are CardioTab's products appropriate for someone with diabetes?
CardioTab's products are not unlikely to be potentially beneficial. Certainly there is a difference based on habits and dietary approach of the given individuals, but for instance, fish oil and the daily vitamin that includes the folic acid might be particularly beneficial. The whey protein has some evidence that it can facilitate weight reduction, and unfortunately most diabetics are struggling with their weight. And so at least those three products would be beneficial. For those diabetics who would have dyslipidemia, particularly with a high LDL cholesterol, then Cardio-T and polycosanol could be beneficial. But all of those products should be in the setting of, or considered in terms of, what other medications are being used and what the physician specifically believes might be beneficial for this individual patient, who really knows the whole history for that patient.
Application in nursing. We render assist 15,000 for under 8 patients with diabetes book Victor evidence of atherosclerosis cardiovascular disease to receiver 1 gram capsules containing 8 and 3 fatty acid. Fatty acids growth or matches placebo oil daily. This primary outcome was a free serious vascular event, non-fatal myocardial infarction or stroke, transient inches attack or vascular leak, excluding confirmed intracranial hemorrhage. The secondary cause was a fresh serious vascular event or antic arterial revascularization.
Hi guys, Dr. Berg here. In this short video, we're going to talk about omega-3s, okay? Omega-3 fatty acids are essential fatty acids, which means they must be gotten from the diet. Your body can't make these fats, okay? Real simply, there's DHA, good for the brain, the eye, and the heart, okay? So DHA is like food for the brain, especially. And because the eye is an extension of the brain, it's good for that too, and as well as the heart. You can get it from fish oils, if you're a vegan, algae, eggs, pasture-raised organic, of course, grass-fed beef, and there's quite a few other foods. But DHA is really important if you have any type of dementia or memory issues, okay? Then you have EPA. Now that's good for the eye, the heart, and it's a great anti-inflammatory. But it's also good for other things as well. But these are the main things right here. You would get it from the same thing: fish oil, fatty fish, by the way, algae, pasteurized eggs, grass-fed beef. All right? And then there's something called ALA. That's good for the heart, cognitive function, the brain, and it's a good anti-inflammatory. So you would get this essential fatty acid from flax, chia, and walnuts. There's other things as well, but these are the ones that have higher amounts. The problem is that when you buy the oils and you expose this delicate oil to oxygen, it oxidizes really fast. It goes rancid really fast. The best thing to do is to grind it yourself or consume some high-quality oil that is in a dark bottle that's really, really fresh. Now, there is some data out there that this fatty acid will convert to EPA and DHA, but only 0.1 to 0.5%. It's less than 1%. So if your body is stressed or sick in any way, you're not going to convert this fat into these at all. So just make sure that you're getting all your omega-3. If you're a vegetarian, get it from the algae, but also make sure you get the ALA from flax or chia or walnuts, all right? Thanks for watching. Hey, thank you so much for watching. Keep spreading the word and share this video.
Pros and cons. It shows variability in the effects of metabolic parameters such as glucose and both lipids such as cholesterol and LDL. There are also other mechanics in addition to those already known, such as oxidative which explain the beneficial effect in humans in this disease. Therefore, recommendation for this use of omega-3 acids can be used as a combined interpreter of disease.
Hey guys, Dr. Axe here, founder of draxe.com and Doctor of Functional Medicine. Today I want to talk to you about the benefits of omega-3 fatty acids. And omega-3s are crucial for your health. In fact, I would say around 95% of Americans aren't getting enough omega-3 fats in their diet. And there are two types of fats that you want to keep balanced in your body: omega-3s and omega-6s. Most of us have way too many omega-6s, not enough omega-3s, and that causes inflammation. Well, many of you have probably heard of something called an anti-inflammatory diet, which typically goes with things like the Mediterranean diet today. But inflammation is a major cause or the main cause of all disease today. In fact, anything that says itis at the end, itis in Latin, that means inflammation. So arthritis, that's inflammation of your joints. Ulcerative colitis, that's inflammation of your colon. In fact, heart disease today, it's not caused from high cholesterol. Why does the cholesterol lay down in the first place? Well, there was inflammation in your arteries. So if you want to heal from any chronic health condition, you've got to reduce inflammation in your body. And the best way to do that is to get more omega-3 fats in your diet. And you really got to start with food there. You want to start consuming grass-fed animal products like grass-fed beef and bison. That's a great place to start. When you're buying eggs, you can buy free-range eggs or omega-3 eggs. That's another good place to start. And then, of course, wild-caught fish like wild salmon and mackerel, even sardines. But doing wild-caught salmon 2 to 3 days a week is a great way to boost your omega-3s. Also, consuming super seeds like chia seeds and flax seeds are packed with omega-3 fatty acids. And last but not least, the majority of people today should be taking a quality omega-3 supplement in the form of fish oil or cod liver oil. Fish oil, you want to buy a better brand, something that's well protected so it doesn't oxidize. But fish oil, 1,000 milligrams a day, is your key to balancing out those omega-3 levels. So the benefits of the omega-3s, reducing inflammation, helping reverse heart disease, reducing your risk of cancer, helping with athletic performance and recovery, weight loss, improved brain function. The list could go on and on and on, especially even for things like brain for mood and depression and things along those lines. But again, you need to get more omega-3 fats in your diet if you want to reach your optimal level of health.
Issues application in Ecuador. Patients with diabetes and new evidence of cardiovascular disease. Weak resist a diet regime of 1 gram capsule of n-3 fatty acid did not have a significant lower incidence of serious vascular events. Thus, 2 work receive placebo after a follow of 74 years. There also was no significant big growth difference in the incidence of a secondary composition outcome of serious vascular event or revascularization.
Fish oil can be obtained from eating fish or by taking supplements. Fish that are especially rich in the beneficial oils known as omega-3 fatty acids include mackerel, herring, tuna, salmon, cod liver, whale blubber, and seal blubber. 2 of the most important omega-3 fatty acids contained in fish oil are eicosapentaenoic acid, EPA, and docosahexaenoic acid, DHA. According to research conducted at Harvard University, omega-3 fatty acids deficiency ranked as the 6th highest killer of Americans. If you don't eat a lot of oily fish, taking a fish oil supplement could help you get enough omega-3 fatty acids and the amazing health benefits that comes with it. 1. Good for your heart. According to the American Heart Association, AHA, clinical trials have shown that omega-3 is effective in reducing the incidence of cardiovascular disease. Fish oil is a great source of omega-3 and therefore reduces the risk of heart diseases and heart arrhythmias. It also lowers the level of bad cholesterol, LDL, and increases the level of good cholesterol, HDL. 2. Clearer, younger-looking skin. Fish oil also benefits the skin in a number of ways, including nourishing it with fats and fat-soluble vitamins that help give it a smoother, softer, elastic texture. There's even some scientific evidence that it can help prevent premature aging and signs of aging like wrinkles and fine lines. 3. Prevent diabetes. Fish oil supplements may also help reduce the risk for type 2 diabetes, as well as prevent complications for those with the disease. The omega-3 fatty acids in fish oil are able to raise levels of a hormone called adiponectin that's linked to insulin sensitivity, as Harvard researchers published in the Journal of Clinical Endocrinology and Metabolism found. 4. Weight loss. Fish oil has also been proven effective in aiding to weight loss. Greater weight loss has been shown in adults taking fish oil supplements throughout their weight loss program compared to those who didn't take fish oils. The majority of bodybuilders and gym rats swear by fish oils in improving blood circulation and tightening skin after weight loss. 5. Improved immunity. Fish oils aid in boosting your immune system, helping you keep your system regulated and fighting off common colds, coughs, and flu. Omega-3 and omega-6 fatty acids have shown to be effective in controlling the amount of cytokines and eicosanoids in your body. 6. Boosting memory. Not only can fish oil help improve mental health, but it can strengthen your brain in other ways, including boosting your memory. Research found that when a group of 18 to 25-year-olds consumed fish oil pills daily for 6 months, they experienced a 23% increase in working memory. 7. Fertility. Research has shown that boars with diets high in fish oil had enhanced healthy sperm count. While it varies person to person, many have claimed it to be the reason for their fertility to increase drastically since beginning to consume the oil. If you do decide to take fish oil, please follow the dosage instructions on the bottle.
Conclusion. Among patients with diabetes without evidence of cardiovascular disease, there was no significant difference in the risk of serious vascular events with doses once uric acid to receive n-3 fatty acid supplement and doses were uric acid to receive placebo.